Hey everyone, I know you love the top tips, so today we're going to talk about 3 types of concussion and vision issues that you might see, how they're going to present, and what you can do about them. Okay, so type number 1 of a vision issue that you may notice post-concussion is convergence insufficiency. That's when the eyes are having trouble converging inward to maintain focus on a single image. If your patient has a convergence insufficiency, functionally what they may say to you is that they're experiencing pain, dizziness, balance deficits, or double vision. And what you can do for that is use a fixation. Have your patient fixating on an object at the wall, walking towards it, moving towards it. Make sure that they're doing things like anti-suppression training. Spot patching is also extremely helpful for this type of patient. Another vision issue that you might see is oculomotor functions like pursuits or saccades. This can often be a problem with the cranial nerve 3, 4, or 6. And in this instance, your patient might say that they have difficulty reading tasks. They might have blurred vision. Words could be moving on the page. They may have double vision, specifically when looking down, which is always a dead giveaway. When they're looking down the stairs and they have double vision, that's what you're going to be thinking of. But with this patient, you're going to incorporate reading into your therapy. You're going to give them anti-suppression training as well. Use of a metronome with eye exercises is extremely helpful, and movement-based activities, specifically movement-based activities that incorporate a cognitive component. And the last one we're going to discuss here is accommodation. If your patient is having problems with accommodating their eyes to moving tasks or as they're moving along, they're going to complain of blurred vision, words moving on the page, they're going to have difficulty driving, so that's a problem. And they're going to have difficulty with exercise or sudden tasks because their eyes aren't able to accommodate, so it's going to elicit a lot of dizziness. So for this person, you want to work on near-far activities, have them focus on something up close, shift their attention to something far away, and so on and so forth. Make sure that you're doing accommodation and ambulation at the same time so they get used to moving around and accommodating their vision. Any movement-based activities are great, and reaction time tasks. So think about playing catch, tossing a ball, things of that nature are very helpful for accommodation. Vision impairments are incredibly common post-concussion, but they're so nebulous compared to the vision issues we're used to seeing. Post-stroke, you can have a patient complaining of anonymous hemianopsia, where they're just not using half of one eye, or even visual neglect, where they disregard use of one eye altogether. Whereas post-concussion, the visual impairments we see are a bit more nebulous and can be a lot more linked to function. So as a physical, occupational, or speech therapist, you're more likely to pick up on visual issues post-concussion, and it affects every domain of what they work on. So it's something that we can all be working on together. So I'm going to link with some resources below for vision issues and concussion. I hope you give them a try and let us know how you get on with them.